Welcome to What's Next. Medicare cost plans won't be available in most Minnesota counties in 2019 due to a change in federal law. Now, the change affects more than 400,000 Minnesotans, but the big thing is to stay calm and check your mail. Ed Arias of Blue Cross Minnesota Edina joins me now to help us sort it all out. Thank you so much for joining us.
Thanks for having me.
Now, this is a big deal. We've known it's coming, but we don't know what those changes are. So what is happening to Medicare?
The first thing that I love that you stated was stay calm. Anyone who has coverage today will have whatever plans they have, a cost plan or otherwise, they'll have their plans effective through the end of the year. So there's nothing you can do to make a change today. Medicare has, or the Center for Medicare Services has decided that they're no longer going to let carriers such as Blue Cross Blue Shield of Minnesota offer cost plans in all of the country, but specifically here in Minnesota, outside of 21 counties that'll still have access to those plans.
Okay, so now we have a graphic of those counties, and it literally looks like it's half the state of Minnesota, but what is included in that is Hennepin County, St. Cloud. I'm not sure if Rochester's in that, but it looks like it's divided right down the middle of the state. So tell me about that. What's the difference there?
The biggest reason that some counties get to keep the plan is that there aren't enough options available for them to be able to lose those cost plan options that are available to them today. So you'll see that when we get to the more outstate counties, there are less access to plans, and because of that, the federal government, or Center for Medicare Services, has allowed carriers such as Blue Cross Blue Shield to continue to offer those cost plans in those counties.
So are all Medicare cost plans going away?
Outside of those 21 counties, yeah, the cost plans will be what Medicare calls sunsetting, or no longer available after December 31st, 2018.
But right now, everybody's good. It's that December 31st thing that everybody needs to start looking at. So how will people know if their plan is going away?
The first thing is just hang in there. You're going to get mail from us. You probably already started receiving some correspondence just letting you know that there are changes coming. By September 15th, all of the carriers, including Blue Cross Blue Shield, are required to provide you with a final notice that actually tells you if there's a plan option that's available for you in the coming year that we'd like to migrate you to. We'll give you the specifics of what that is by September 15th.
Okay, so then what happens to the folks who then are losing their cost plan?
So the folks that are losing their cost plans will be given different options for plans to buy. They'll be in the marketplace. There'll be Medicare Advantage plan options for them to choose from, as well as Medicare supplements and, of course, prescription drug plans.
And I know there's fear. Anytime there's changes or you hear that you're going to lose a plan, there's fear. So I'm thinking that there will be a lot more options, perhaps, than maybe they had before.
So
we don't know yet.
We don't know yet, right? Because
Okay.
Medicare doesn't allow any of the insurance carriers to talk about any plan offerings until October 1st.
Okay. All right. So as of October 1st, they really need to circle their calendar on October 1st. They will have had notifications via mail. But then once October 1st arrives, then they really need to start looking at their plans. So that comes under the when can seniors make necessary changes?
Correct. So October 1st is the first time you can actually meet with your agent or come visit one of the representatives at one of the 3 Blue Cross Blue Shield retail centers. What we can do beginning October 1st is educate you on the new plan options that are available to you. However, Medicare has an enrollment guideline that states no one can complete a new enrollment form for a new plan until October 15th.
So if somebody comes to see you, they don't necessarily have to sign up for a Blue Cross Blue Shield Minnesota plan. Is that correct?
On October 1st, they won't be able to.
Okay.
Now, they can fill out all the paperwork, but they can't sign it or date it or submit it to us until October 15th.
Okay, so really they've got a couple of weeks to get all their questions answered.
Well, more than a couple of weeks, because what I'd like to remind folks is that this is still the annual enrollment period for Medicare. So you get 7.5 weeks to make a choice.
Okay.
7.5 weeks takes you from October 15th to December 7th.
Oh, okay.
That's your annual enrollment period for everyone who's eligible and wants to pick a new plan during that enrollment period.
Okay.
This year, because we have so many people who have these plan changes happening to them, Medicare is offering what's called a special enrollment period for any cost plan member, they'll get an extension beyond December 7th. They'll get an extension to December 31st to make a plan change.
Wow, okay. So those are all the dates to be that we have to circle on calendar. So October 1st, October 15th, December 7th, and then December 31st.
Correct.
Okay. Great. Okay, so our conversation, by the way, if you have any questions, we'll put this up on the screen right now. So you can go to bluecrossmn.com/Medicare changes, that's one word, or you can also go to visit Medicare.gov. And we're going to continue our conversation again on Medicare coverage plans on what's next. And we're going to do another interview. So that interview will air September 27th at 7 p.m. And that's right before the October 15th date when you can start enrolling in your Medicare program of choice. But again, let's go back to that screen with bluecrossmn.com/Medicare changes, one word, or Medicare.gov. Those are the sites that can also help you sort through a lot of this. But in the meantime, check your mail, stay calm, and thank you for joining us.